is defined as an inflammation of the inner lining of the vermiform appendix that spreads to its other parts. This condition is a common and urgent surgical illness with significant morbidity, which increases with diagnostic delay, remains a clinical emergency and is one of the more common causes of acute abdominal pain. Anatomy of the appendix. The average length of the appendix is 8 to 10 centimeters. It's shaped like a small cylindrical tube, implanted in the inner bottom of the blind at 2 to 3 centimeters below the ileus. It begins with the obstruction of appendicular light, then there is an increase in intraluminal pressure, ischemia of the appendicular mucosa, bacterial infection and finally perforation of the appendix. Signs and symptoms, begins with periumbilical pain that radiates to right iliac pit, fever, nausea, vomiting, periumbilical pain. In many cases, the exact cause of appendicitis is unknown. Experts believe it develops when part of the appendix becomes obstructed, or blocked. Many things can block your appendix, including a buildup of hardened stool, enlarged lymphoid follicles, intestinal worms, traumatic injury. Diagnosis of appendicitis. To help diagnose appendicitis, the doctor will likely take note of your history of your signs and symptoms and examine your abdomen. We use lab tests such as hematologic biometrics, urine tests. These will allow us to rule out infections. A high leukocyte count, about 17,000, is mentioned as an indicator of severity, which targets complications such as perforated appendix or gangrene appendicitis, but this finding is highly variable. A normal white blood cell count should not be used to rule out appendicitis. Treatment of appendicitis is surgical and urgent, includes the assessment of the general condition of the patient with a replacement of fluids in case of alterations in electrolytes. The appendix is then removed and inflammation removed in a process called There are two surgical methods. Open appendicectomy is surgery to remove your appendix through an incision in your lower abdomen. Laparoscopic appendicectomy, the surgeon makes a small incision on the lower right side of the abdominal area. It can also be removed using small surgical incisions and a camera.